Hi, I was sent this article about the rising rate of cancer in young people, and yes, unfortunately, this is true. This article concentrated on colorectal and breast cancer as well. I find it interesting that they used a picture of a racialized woman because we do know that the incidence of breast cancer is lower in racialized women, but the mortality rate is at least 40% higher in Black women. Let's not forget that the guidelines for breast cancer screening in Canada are still very much a topic of discussion. This article correctly pointed out that in the States, the colorectal screening age was dropped to 45. And don't forget that they also dropped the screening age for breast cancer from 50 to 40. But in Canada, even though it is very clear and stated in the guidelines about the higher mortality in Black women, especially in the 40 to 49 age group, there was no effort made to change that screening age. The article mentioned that the task force guidelines stopped short of recommending that everybody do it. Not to be forgotten are the under 40 age group people. In Canada, we have seen a significant rise in the 20s and 30s as well. This is a group that is not routinely screened, but there are things that can be done. Be breast aware. If you're watching this, you most likely are. Share it with your young friends, your teenage daughters. Share it with everybody. It's never too early to start the conversation. It seems to me that it's important to talk about the birds and the bees. So let's make this a normal part of our conversation. I love something about the newer generation because they're more open to talk about things like this. Self-breast examination is part of being breast aware. Make that a regular part of your practice monthly. And if you follow me, you know I always say you don't have to do it on the first of the month. Just make sure you get it done during the month, right? Know your family history. That's important, especially in instances where there may be a hereditary form of breast cancer. Get a risk assessment by age 25. This tells you your lifetime risk of developing breast cancer and is as simple as an online tool, such as this one. Live an active, healthy life, physically, and don't forget mentally. What are you feeding your body and your brain? Life is so much harder now than even when I grew up. You do, however, have a choice to control what you put in your body and in your mind. And we do all this, everything in moderation. In the absence of all the above, if you do have symptoms such as maybe increased breast size, decreasing breast size, hardness, dimpling, a rash, bloody nipple discharge, a lump in your armpit, don't ignore it. See your primary care physician and get help, which should include some form of imaging to figure out what's going on. Do me a favor, please. Share this with your friends, your family. You never know, you may just save a life.